Welcome to PATH's first virtual town hall meeting. We are live on Zoom and with our 10,000 followers on Facebook. My name is Joel Roberts and I'm honored to be the CEO of PATH and PATH Ventures. PATH is a statewide homeless services and housing agency. We actually operate in 140 cities across California and in several counties: San Diego County, Los Angeles County, Orange County, Santa Barbara County, Kern County, Ventura County, San Luis Obispo County, and Santa Clara County. And in fact, this month we're opening up a new PATH community hub in Sacramento County. We actually have 9 permanent interim housing shelter programs with over 1,100 beds. We also have another agency called PATH Ventures, and it's our supportive housing development agency. And we currently have 14 supportive housing apartment buildings across the state. We're in construction with 3 new ones, and we're planning 4 more. Today is Giving Tuesday, and more importantly, today we're in the middle of a worldwide pandemic. And as you know, COVID-19 became a significant crisis here in California about 2 months ago. It has affected everyone, especially those people who are vulnerable on our streets. So since 2 months ago, we, PATH, have actually set up 5 more new interim housing facilities, including 2 of those that help people who are homeless and who have symptoms of COVID-19 or who are actually testing positive. We also continue to provide street outreach in numerous California counties. In fact, we're still working in the whole Los Angeles metro system on the trains and buses, and we're even working at LAX airport. We also are providing the much needed support for our residents in PATH Ventures supportive housing apartments and in scattered site. We're literally supporting 4,000, actually more than 4,000 people who are already housed in apartments. We're buying groceries for them. We're providing counseling. In one location, they're even giving virtual tours of museums on iPads. As most of the state of California shelters in place during this crisis, we, PATH, are considered an essential service. So all of our team members, except for those in vulnerable categories, have committed themselves to continue our work, to continue to save lives. In fact, we've created a motto during this crisis, and our motto is, "We're not home until they're home." Now I'd like to turn our town hall over to Jennifer Hart-Dietz. She's our Deputy CEO, and she's also the Executive Director of PATH, and she has been the team leader for our response to COVID crisis. Jennifer?
Thanks so much, Joel. And we are so excited, as Joel mentioned, to be able to connect with all of you, our supporters, today on Giving Tuesday. I'm going to share a little bit about the format of our town hall today. So we are saving time at the end for question and answer, and you can find a Q&A chat form on your Zoom call. If you go ahead and enter them in there, we will spend some time at the end answering any pertinent questions you have to our response for COVID-19. We are leading this call because we want to connect directly with our community members. And we've also been leading calls like this for our all staff every week. And we've seen that it's a really great way to be able to connect during this transition to more virtual meetings. Our leaders from across the state are on this call today to share with you what we've been doing. As Joel mentioned, we're not home until they're home. And we really had to change our response in light of COVID-19 to ensure that the health and safety of our most vulnerable, as well as our staff, was at the forefront. So I'll give you a general update of what we've done. We started off by immediately identifying a task force. That includes people from our executive team who can make quick decisions. Sometimes we're on the calls in early hours in the morning and late hours at night because we know that CDC and our departments, county departments are releasing information sometimes daily. And we want to make sure we can get that information out to our teams. We're also on the front lines providing things like basic hygiene items, making sure our staff have access as well as the people that we serve. We're providing social enrichment opportunities like Joel mentioned, and really trying to educate people around how to avoid social isolation during this time and how to meet the needs that they have in order to continue to grow and improve their quality of life. Because our mission hasn't changed. Something that has taught me more than ever is that our mission is even more critical and crucial because those who are out on the streets have even more of a vulnerability now. So we have to continue, and we have to continue to be part of the solution. So I'm going to start off by turning it to San Diego. Jonathan is going to be sharing what we've been doing directly in the region for the whole San Diego County.
Good afternoon. I am speaking to you from our Path Connections building located in downtown San Diego. We've been taking a lot of efforts here to make sure that we are responding to best support and protect the people that we serve. So some of the efforts that we've made is that we've decompressed our interim housing program to make sure that we're falling in lines with CDC guidelines and social distancing. We've amplified our janitorial staff by double to make sure that our doors and our floors and our kitchens continue to remain safe and sanitized. We've hired additional staffing to make sure that we're covering the cost to operate aspects of our program that have been, that were operated by volunteers. We've had an 87% reduction in volunteers during this period. And so we've really had to make sure that other operational aspects continue. We have a health clinic in San Diego known as Family Health Centers of San Diego that's co-located inside of our building. They've really stepped up in a critical way where they're providing regular COVID testing for all of our clients here to make sure that they are being kept safe. We started a brand new initiative called the Path Cooks Mobile Program that's actually focused on providing meals to people who are unsheltered and recently placed in a motel to make sure that they are able to practice shelter in place. These individuals were placed into the motels because they may have been older adults or individuals with underlying conditions. So our Path Cooks Mobile Program is now taking out food 7 days a week to the individuals in the motels. And this is being done with our volunteer supports as well as our staff. Our street outreach teams are really focused now on making sure that education is being provided to all of our clients who are unsheltered, that they are providing PPE as necessary, that they're providing basic needs such as food, and we're coordinating with other efforts going on within our community to make sure that people are getting shelter when it's appropriate. We have a program here in San Diego known as Whole Person Wellness that's really focused on providing care coordination for people that have acute and chronic medical and mental health needs. And so we're collaborating with the county motels to make sure that that people who are in the motels, that we are getting connected to them so we can provide the support needed during this time, and that we can continue to provide the support post-pandemic to make sure that we're getting them connected to permanent housing and connected to all the resources they need to make sure that they are living healthy and well lives. So thank you.
So much, Jonathan. It's really been remarkable to be able to see what the team has been able to do. Many of you may know that Path has over 700 employees throughout the state, and they have all been able to be extremely dynamic and flexible. And I'm going to turn it over to MANVIR now in Orange County, who was able to open a new interim housing site despite this crisis. So we've now opened Path Orange County. MANVIR, you're on.
Good afternoon, everyone. My name is MANVIR. I'm live at Placentia Navigation Center in Orange County. It's been a month and 5 days since our shelter opened. We are at 92 right now. We have single males, single females, and couples. We have been taking steps to comply with COVID guidelines required by CDC. During opening, we asked COVID triage questions and monitor temperatures. We also had mobile health clinic to check guest symptoms upon intake. We also have an isolated area in case our guests experience any illnesses. And we have been checking their temperatures 3 times a day. Even though we are limited on resources due to COVID, we have been referring people to Chrysalis for job placement and scheduling virtual intakes. We are setting up virtual doctor appointments. We have been regularly conducting groups to engage our guests, such as game nights, Bible studies, arts and crafts, life skills group, resume building, and we also have wellness recovery groups led by our guests for community engagement. We continue to ensure our guests receive support and services with limited resources during this COVID-19 crisis. So yeah, so that's all we have. Thank you.
Thank you so much, Manvir. It is really remarkable to see everyone come together for PATH OC. We've also seen, and we know that Los Angeles has an enormously large homeless problem before COVID-19, and we're very concerned about what's continuing to happen in LA as people may lose their homes due to unemployment and other factors. So TESCIA URIBE, our Chief Program Officer, is actually going to share about some of the solutions that we have implemented in the past 5 weeks in Los Angeles County.
Hello. So I'm here and in addition to running our almost 500 interim housing beds here in Los Angeles County, in the last month and a half, we have opened 3 new sites. So one site is called, it's called a isolation and quarantine site. And what that means is it is a site that is for individuals who have either been exposed to COVID-19 or who have tested positive. All the referrals are done through the Department of Public Health. And on site, it is a really amazing group of folks that come together. It's Department of Public Health medical staff, it's the fire department, EMT officers, PATH staff, people who are responsible for facilities. So it's really amazing to see everybody come together. In downtown Los Angeles, we have one site that has 284 people that we're serving. And in another area of LA County, we have 117 rooms. In addition to the isolation and quarantine sites across the state, there's sites opening up called Project Room Key sites. And these are for individuals who are either on the street or in congregate shelters, and they're age 65 and older, or have underlying health conditions that make them exceptionally vulnerable if they were to test positive for COVID-19. And so this allows them to have their own individual room and isolate and stay safe. The partnerships at these sites are made up of providers, medical staff, the fire department, as well as county and city employees, which is really cool for them to get to see the work we do. They're county and city employees who, instead of electing to be furloughed, they've chosen to help out at these sites and deliver meals, you know, and just coach people, talk to them. So I think in the midst of this pandemic, and as scary as those types of things can be, we're really seeing community come together, and it's very exciting. So thank you for being on and listening to what we're doing.
Thanks so much, Tescia. You know, I've seen a few more people have joined on, so I just want to remind everyone of the format. You are welcome to ask questions using the Q&A feature, and we are going to save some time at the end. We'd love to hear directly from you and answer any questions you may have. So this is a good segue actually to our Santa Barbara region. Tescia mentioned the Project Room Key sites. That's actually a statewide initiative, and so we have a team member, Catherine, in Santa Barbara, who's going to share about our Santa Barbara facility, the newest one, as well as our ongoing services that we're providing to our most vulnerable.
Hi, everybody. I'm Katherine SOTO-VASQUEZ. Thank you for joining us today. As Jennifer mentioned, I am working with the county at one of the Project Room Key sites here in Santa Barbara in one of our lovely hotels. We officially opened on 4/20 with a capacity of 75 rooms. So we're in week 3 and we have 43 rooms filled. And we're working with individuals that are asymptomatic and are at highest risk should they contract COVID-19. So it's individuals that are 65 and older, have an underlying medical condition. And so far, so good. One of the biggest concerns for our individuals living on the streets was how they were going to manage isolating in a room by themselves. Some individuals can't fathom that idea. But with the hard work, the diligent work of our outreach teams and our service providers, kind of screening and prepping the individuals before they transition into the hotel setting, it's been amazing. It's been smooth sailing for us. The individuals really feel supported here. They appreciate the staff, and they are really thankful to have this opportunity. As well as overall, the county-wide initiative coming together. We have Easy Lift on site, helping transport for medical appointments, taking individuals to the store if they need to. We have public health here on site, checking in with individuals for any medical needs that they may need. We're working with in-home supportive services to help those individuals transitioning to a lifestyle indoors, as well as the county staff that I'm here to help guide, as a lot of them may have never really had that face-to-face interaction with a lot of individuals that live on the streets. So that's the update here for the hotel. As well, in Santa Barbara, we have a 100-bed interim housing shelter with operations of a employment program, rapid rehousing, and a lease-up program. And since March, when our governor implemented this stay-in-place order, we have managed to house 6 individuals. So that is our update here for Santa Barbara. Thank you.
Thank you, Catherine, for the amazing work and for all the collaboration that's happening. You know we need everyone to be part of the solution to solve homelessness. And we are seeing that in this crisis, we're seeing so many people come together and recognize that, you know, this is really something that we can only do if we all come together, every member of our community. So that's why we're so excited to have you all joining us today to share with your networks. And we'll talk a little bit more later about how you can do that. Next, we're gonna go up to Northern California, and Serge is gonna share with us about our work in Santa Clara. And remember, we're not home until they're home.
Hello, everyone. Hello, everyone. This is Serge once again, and I am live downtown San Jose on a rooftop of Villas on the Park. A villa is PAB's Permanent Supportive Housing Program. In downtown, we have 80 people, and staff here has been phenomenal. We've been providing resources to individuals here while they're shelter in place, and and reassurance during a time of uncertainty. I oversee the outreach program, and we provide street outreach throughout the city of San Jose. And I tell you, the team has been doing a phenomenal job. Since March 17th, the shelter in place order here, we've been having to modify our services so that we can comply with the CDC recommendation and shelter in places. And so what we've done is focused on 3 categories, which is health, food, and shelter. And when I say shelter, I just don't mean temporary shelter. We've also been keeping us, which is permanent, and that the people that we serve when we're going to do outreach, they don't have access to information when it comes to COVID. So our outreach team has been providing literature and counseling to the folks that are in encampments to let them know how they can help mitigate the spread of COVID. We've also been doing screenings. We've been seeing if people are experiencing symptoms of COVID. And so if they are, we would direct them to proper treatment. We've also been working with VHHP Medical Mobile Unit, where we've been able to identify people with severe underlying medical issues that are vulnerable to COVID, who needs that extra medical assistance but can't access medical care. And so the VHHP has been coming down to the encampments, and we've been coordinated with them so that they can provide our clients with care. We've also been collaborating with the city of San Jose to identify key locations where encampments really need hand washing stations. So the city has been able to place 14 hand washing stations at locations that we've been able to identify. And our team has been doing such a great job at continuously going out to these hand washing stations to make sure that they're well maintained and people have a way to help mitigate the spread of COVID. Now, going through food, we're collaborating with Second Harvest and the city team, which is a local organization in San Jose, in doing food distribution. Initially, when Second Harvest and City Team initiated their food supply project, they didn't have anyone to distribute the food. There were quite a few agencies that had scaled back their outreach efforts, but PATH stepped up and said, hey, listen, we're going to help out. And so since then, we've been distributing at least 50 bags of food in 10 encampments. And I tell you, folks are saying that that's very invaluable. A lot of the meal programs that were set up had to scale back because of COVID. And the fact that we can give food out to people in encampments, I mean, you know, you can see the smiles in their face and they really appreciate that. As far as shelter, we've been collaborating with the County of Santa Clara County with their Project Room Key initiative. They've been creating more motel and opportunities due to the shelters have had to reduce their capacity in order to be in compliance with the CDC recommendation. So our team has been out in the field, going out there, helping people who don't have cell phones, who don't have phones that are charged, making the calls to the referral hotline, getting people connected to these shelters or to these motel opportunities so that they can stay safe. We as a program, we've been able to provide people with some support through motel stays, through our Flex Fund, identifying people who are in transition to getting shelter, but it hasn't happened yet. And so we were able to provide some motel stays for families in crisis, people who have serious underlying issues. And so we've been diligent in terms of helping people with shelter. We are now starting to give support to these shelter facilities. Our outreach team is starting to split their time from doing outreach and also providing on-site case management to those folks who are in these shelter facilities. We're going into 2 shelters. One is Parkside Hall, which was a theater place which was reconverted into a shelter, and South Hall. So our staff will be there 3 days a week, providing case management services to folks there. And lastly, we didn't forget about permanent housing. We're continuing to link people to housing opportunities. We've been able to house close to 12 people in their own permanent homes, and we're continuing to do that. We have 4 more people who have been identified to move into their homes, and we're consistently, you know, keeping our eye on the prize and, you know, continuing with the efforts.
That's awesome, Serge, and it's really remarkable to see the work you all have been doing throughout the county. It's also a good segue. You guys, everyone shared some numbers in terms of housing, but I'm going to share our statewide number. Since we all went into a shelter in place or safer at home order, we've actually been able to permanently house 320 individuals. So that is just an astonishing number. And we also have put in 295 people into interim housing. So, you know, the PATH staff is out, they're out in the field, and now more than ever. One of the things that I think is another huge success is we've been able to have 10 people employed. We know unemployment numbers have been going up, but essential services are still hiring. So we've been really working with our employment programs to get folks into the right employment service. Another thing we have done on a statewide level is we really had to figure out, how do we take care of our staff, right? They are a critical component. We can't do any of this without every single person, no matter what department. So we've made our schedules as flexible as possible. We know there's been closures throughout the state. Schools are closed, and many of our staff are caregivers. So we want to make sure we keep people at work. And our HR team has really been working with each person on an individual level. We also created an online illness reporting form. With over 700 staff, we have to make sure that we are tracking all of this information. And so we are able to follow up with everyone, because there's still, as I mentioned earlier, there's a lot of unknowns, and we want to be able to provide that resource so that people aren't questioning, you know, what they're coming into contact with when they come to work. Some of the challenges, though, have been on a statewide level. You heard some of this: access to basic equipment for staff. You know, Jonathan mentioned the PPE. That's a new acronym for us, the personal protective equipment. That includes things like masks, which we all now have at our disposal, and fingertips, and can't leave home without. But it also includes things like gowns and our gloves and face shields. And these have continued to be challenging to get for team members, as well as to get for you know, the people that we serve. We want to be able to provide them directly so that people can stay safe, whether they're living on the streets or they're in their own home. when this originally started, we really saw a decrease in the food availability, and we continue to see food scarcity be a major concern. As you heard throughout our program, you know, our teams have really transitioned to have the Path Cooks mobile program because we want to make sure those basic needs are met. And then the other one I'll share is just that, as you've seen, our staff are on the front lines. And so we have offered what we internally call premium pay, but what you may all think of as a hazard pay. And that is costly. Many funders are, you know, not approving funding for that, but we know that in order to stay on the front lines, we have to recognize what they're doing. So, you know, so we've had both successes and challenges, and we will continue to provide these updates to you and to our team. We'd like to go to the Q&A now so that we can hear directly from our listeners about, you know, what interests you most? What do you want to know more about PATH doing in the COVID-19 crisis?
Sorry, thanks, Jennifer. So we have a few questions that have come in so far. One question is, how can we take action and help our homeless neighbors?
Sure. You know, when at the end, Joel's going to give some ways that everyone can get involved. But what I will say is that, you know, being part of these calls, being part of the solution, connecting to see how you can get involved is really critical. So that could be through, you know, could be through volunteer opportunities that are, you know, we're getting creative on our remote. Definitely, if you do have the availability to donate, Joel will be sharing that. But I think raising the awareness is also critical. Tell your friends, tell your neighbors that, you know, this is something that you're passionate about, and that this is how they can get involved. And we will definitely share with you more about that at the end.
Great. We also have a question from Bill asking how many individuals, and you might have answered this already, so sorry. How many individuals have you got into hotels via the Project Roomkey sites?
Sure. So statewide, Project Roomkey has expanded in different stages. And our outreach teams are referring people directly through the ways that the counties, each individual county has set up. So it's important that we're getting people into the queue so that their vulnerabilities are identified, so that they meet that criteria. So we've already put in over 100 individuals into the queue, and people are starting to get into those Project Roomkey sites. We've already gotten a handful in, and we expect as more sites open that we'll be getting more and more people in.
Great. Another question that we have is specific to any partnerships with medical providers. Is PATH currently partnering or seeking partnerships with medical service providers? Yes,
so, you know, we actually have a variety of statewide partners on the medical side, and you know, you heard some of our local team members share what those are. But it has been more critical during this time to really make sure that we have those partnerships for the most vulnerable folks that we serve, because the medical concerns are coming up to the surface. So we are frequently in contact with our medical partners. You know, listing them all would be a lot, but some of the ones to really highlight is in San Diego, Jonathan mentioned Family Health Center. In Los Angeles, we have a variety of partnerships. One is with LA Christian. We're working with Holiday Helping Hands with some of our isolation and quarantine sites. We also work closely with our county health partners throughout the state, and they have been a critical partner in this, helping to provide data and information. In Santa Barbara, we work with the county and with Cottage Hospital, and Serge mentioned VHHP up in Santa Clara County. So, you know, partnerships, as I spoke about earlier, have become, you know, even more tightened throughout this process, and really making sure that we have the holistic package and approach to dealing with individuals during this time, and making sure that we can provide all these resources.
That's great. We have a couple more questions. These next two are asking around, can I still drop off donations at PATH? And then a follow-up to that, how can my kids help right now?
So, you know, I think there's been a lot of questions around accepting donations, and we really did tighten everything because we wanted to avoid the risk. So what we're asking is that if you are donating items, that you don't donate anything that is used, just because we don't have the ability right now to just make sure that the virus isn't passed. So we are trying to limit that if there are new items, and if you have food donations that are non-perishable, those can be accepted. And we can definitely push out the volunteer email, volunteers@epath.org, so that you can reach out with specific questions. And in terms of how your children can get involved, I think it's a great question. I know having 2 little ones of my own, there's a lot of unknown and uncertainty during this time, and being part of this solution can actually be a really healing way to get through this pandemic. So, they can make hygiene kits, they can write notes, welcome home notes to our vulnerable neighbors. As I mentioned, we've had over 300 people move home, and we love to give them a handwritten note as well as a welcome package. So that's something that can still be done. You can do that using safe social distancing, or you can do it with your own family. So if you do have specific questions around that, definitely reach out to us. We would love to see everyone get involved.
Thank you, Jennifer. We have a question. Bill is indicating his temple is a longtime partner with PATH, and is wondering if there are any volunteer opportunities for him to mobilize his volunteer group, and who he can potentially contact for these volunteer activities.
Sure. So thank you so much for your partnership, Bill. Thank you for joining today. Again, we'll send out the information to all of the attendees on the specific links, because I know it's hard to write them down, but you can definitely contact us at volunteers@epath.org, and we will respond back to you so that we can set up the specific experience that is the right fit during this time. And our volunteer team is still coordinating and making sure that people are connected to our sites and to the individuals we serve.
A few more questions here. So we have a question actually from Jeremy Seidel. How do you see the current crisis changing our service models permanently, or if at all?
I think, when we're in crisis, a lot of times we're just thinking about today, but we definitely want to always think about tomorrow as well, because we're not going to always be in a crisis with COVID-19. So we've been really kind of thinking through, what do we do today, and what should we be changing tomorrow? Kind of like restaurants are doing now, thinking about how do they change the way they'll operate after COVID-19. So, obviously people are losing their jobs. We're really worried that more people are going to become homeless, more families are going to be homeless. So we've been thinking through how we can expand our homeless prevention programs, our rental assistance, eviction prevention. We also think employment, people are losing their jobs, so we think employment programs are going to be very important. We have some employment programs, and we think we'll probably have to expand those as well. And finally, it's still all about housing. The only way we're going to end homelessness is if we can get people into homes. And so we're trying to think through creative ways of how we can build more homes, how we can build them cheaper, how we can build them faster. So definitely we're trying to think about the future.
Thank you, Joel. So we're going to go to a question here from Dana. Dana's asking if we have a toolkit or resource for advocacy at local neighborhood councils regarding COVID relief efforts, including long-term solutions.
Yes, that's a wonderful question. And, we actually have been fortunate to have, we have a director of public policy who's really been helping to advocate for nonprofits, as well as, with state, federal, and some of the other relief that's coming out. So we can definitely push information out so that you can help be our advocates as well, so that we know that those that are on the front lines, right, need to know kind of who's supporting them and what resources that they have. So I think it's a great idea to really put together some of those asks, and we can let you know what those are.
Joel, this might lead into maybe your next sort of closing statements. There's a question here around what does PATH need the most help in right now? This question was specific to LA, but I think we can speak to it as our statewide agency approach.
We don't see ourselves just as a charity. We really see ourselves as a movement. So we're just trying to get as many people involved in the work of helping our homeless neighbors get into homes. So, that's what we want. It's not about money. It's about just getting involved in any ways you can, because we do think this is a movement.
Great. I think we can give maybe a few more minutes if you're interested in seeing if any more questions come in. unless you want to share any additional thoughts, Jennifer or Joel.
Sure. I'll share for just first. I want to thank you, Carlos, our Chief Innovations Officer, for doing the Q&A. We have been getting really more tech savvy, and Carlos has been helping us quite a bit with that. And I also wanted to share. Some of you may, have asked what's to come, and then Joel will close us out. But we actually were able to open PATH Sacramento. The program started on May 1st. Providing intensive case management services to individuals who are vulnerable and experiencing homelessness in the Sacramento region. So, we are continuing to really make sure that we're filling those really big gaps for those who are homeless, our homeless neighbors, homeless outside. And so we will continue to provide you those updates and make sure that our supporters have the most up-to-date information. So Joel, you want to go ahead and close us out for today. We appreciate you all joining us, and thank you to our team members for the amazing work they're doing.
Thank you, Jennifer. It's really great to hear from our team throughout the state. And as I shared, we're not just a charity, but we're a movement. And you can see just with all the people from staff to volunteers to board members, throughout the state of California that are really committed to trying to help people get off the streets and into their homes. In fact, PATH is literally helping 20% of all of California's homeless population every year. This pandemic has really kind of shown how important it is for us as a society to help people who are homeless. When they said shelter at home, the first thing we thought of was there are a lot of people that don't have homes. So how are they going to shelter at home? So yes, we can help people shelter at shelters, but we really need people to shelter at home every day of the year for the rest of their lives. And that's what we're about, is trying to help people get home, to make it home, whether there's a pandemic or not. And we really need your help. Again, it's not, it's about a movement. We need everybody involved in this. So today's Giving Tuesday. So if you would like to give, please click at epath.org/COVID-19. Our board of directors have actually raised $200,000 as matching gifts. So every time you donate in the next month, it will be matched. And if you want to just buy things, home kits and care kits, you can go to our Amazon wish list. But we're very grateful for you being part of this movement that we call PATH. And we just want you to remember that we're not home until they're home. Thank you very much, everybody.